Good afternoon, everyone, and welcome to today's Bluetongue virus update and Q&A. My name is Leah Shanks. I work in the AHDB Beef and Lamb Engagement Team, and we're joined this evening by my colleague Laura Audrey, who works in the Dairy Engagement Team, and our speakers, Tony Goodyear from AIMS and Gordon Hickman from DEFRA. Sascha van Helvoort from APHA is also due to join us, but she has been out with the Secretary of State today, so she might not get here in time, but we'll do our best. So I'll just go through a little bit of housekeeping with you before passing over to Tony. So we will be recording this webinar. So if you know of anyone that is also interested, it will be circulated within 24 hours and uploaded onto YouTube. Equally, if you'd like to listen back, you need to leave early. It will be available for you. We will hear from our speakers to begin with, and then there will be an opportunity to ask your questions at the end. There's a box. I mean, on my screen, it is a little speech bubble with a question mark in it. That is your question box. Hopefully it appears the same on your screen. Just type your question in there, please, and we'll get through as many as we possibly can today. There will be a feedback form that is sent to you at the end of this webinar. If you have any additional questions, if your question wasn't quite answered, or any topics that you're interested in, please do fill in that feedback form and tell us how we're doing with these. We're doing these webinars weekly at the moment to provide a platform to ask your questions. So do just keep firing them in and give us any feedback that you've got. We've got some resources available for you. So today is an update and a Q&A. We're not going to go through a lot of the historic information, and we're not going to touch on a lot of the information we have done in previous webinars. However, it's all available for you. If you go on the AHDB website, on the homepage, there is a tile for Bluetongue, and there is a link to all of our previous webinars. There's also a wealth of information on the Ruminant Health and Welfare website. Link is on the screen now, and there's a QR code for you there. There's a Bluetongue hotline available for you between the hours of 9 and 5, number on the screen there, 024 771 0386. And on gov.uk, you'll find the latest updates and news on Bluetongue. So lots of information out there for you. Please do consult those pages. Just to say as well, an update since a previous webinar is that we have a licensing table full of information uploaded on that Ruminant Health and Welfare website. Perhaps take a picture of this screen or take a picture of that QR code and you'll be able to access that there. I think it's also reflected on the AHDB website, so if you go through that Bluetongue page, you'll be able to see a similar table. If you haven't already, I would urge you to please subscribe to the APHA Animal Disease Alert subscription service. There are instructions on the screen now how to subscribe. It's a very simple process. You can subscribe for email alerts or text alerts, or if you scan that QR code, it will take you through to the same website, and you should get updated by APHA with the latest disease alerts. And finally, from me, just want to highlight all the additional support that is available. I would, again, if you could take a picture of this screen in case you need it. You might not need this information now, but you might do in the future, or you might have a colleague or friend that also would benefit from some of these supporting charities. So without further ado, I will now hand over to Tony to talk about designated abattoirs.
Thanks, Leah, and good evening, everyone. At present, we have 41 abattoirs which have been designated for handling Bluetongue livestock. You can see them on the map there. And if we quickly click to the next slide, what I've done is I've just superimposed over the control zone. So you can see that we have some within the restricted movement areas and most of them out of those areas. There's 41 to date. What we've tried to do is to simplify the application process for abattoirs. So one of the vets who works with AIMS has written a standard operating procedure which has been approved by DEFRA and the FSA, and that we've sent to every ruminant abattoir in the country, whether they're members of ours or not. And we hope that that will bring more people in. We do know that there are at least 3 more of our members currently in application. 2 of those are in Staffordshire and one's in Essex. The one point that I found quite interesting was that actually 2 of the sites are what we would term as micro plants, namely they're very, very small abattoirs behind butcher shops. One is in Kimbolton and the other one is in Hertfordshire. So really, any size of abattoir can apply, and we would recommend that they do that. Go to the next slide, please. So that's a list of the 41 abattoirs, and what you can see on there is that basically all of the big abattoir operators, wherever they've got sites in the UK, have become designated sites. In addition, the two in green are halal only sites, and we are expecting a couple of other halal only sites to join up, well, hopefully become designated in the next week or so. One of those is in Yorkshire and the other one is in Wales. And we feel that we've spoken to every abattoir, every ruminant abattoir, and we were given some feedback about paperwork and the application being too long, which is why we've done the standard operating procedure to make it easier for them. So we do hope to see more abattoirs become designated. And of course, designation lasts for a year, and renewing is much quicker than just simply having to reapply. So we are trying to encourage as many abattoirs in as possible. And that's my slides done. I will be taking questions later.
Thank you, Tony. Over to you, Gordon.
Good evening, and thanks for inviting me back. So this is going to be a shorter update than usual, but really just to reinforce what Tony's just said, we're really keen that as many abattoirs as possible do sign up to be designated. It minimises the impact on producers because they can continue to use their normal outlet. Because if you are in a zone, you either need to use an abattoir within the zone or you need to use a designated abattoir. So I think the significant change that has happened since we spoke last week, obviously disease was first confirmed on the 26th of August. When I last spoke to you, we had those two restricted zones, sort of a northern area and a southern area. Over the weekend on Saturday, I think it was, we've now merged those two zones and effectively brought it out a county wide. So you can see the map there on the right hand side. So we go all the way down from the East Riding of Yorkshire down through into West Sussex, so including, we've added in Surrey, West Sussex, Hertfordshire, Bedfordshire, Cambridgeshire, and the rest of Lincolnshire. So the reason we did that was because we were starting to get cases on the border, just inside the old restricted zone or just the wrong side of the border. So we had cases on the East Sussex, West Sussex border. We had some on the Hertfordshire border. We had some on the Cambridgeshire border, both the bottom of Cambridgeshire and towards the top. So we decided to extend that zone because what we're looking to do through these zones is to contain and slow the spread of this disease. Clearly, we can't stop the midges themselves moving, but what we can stop or slow is animals that are infected moving long distances and then setting up local focuses of infection. So it's still warm enough for ongoing transmission. So next slide, please. So where are we at the moment? So we're on 98 premises having one or more animals that have had confirmed Bluetongue 3. And that restricted zone, as I've just said, goes all the way from East Riding of Yorkshire down to should be West Sussex now. There's also, and you may have heard this, there's a case in Bath and North East Somerset that doesn't have a zone. This is linked to a traced animal that moved from a premises, one of those infected premises, before it was confirmed as a premises and before it was in a zone. It was picked up through our tracing activity. Because we know where it came from and all the lab results indicate that it was infected before it arrived on that premises, we've not put in place a zone. Instead, we're testing other animals on that farm and in and around that. And if we don't find anything, we won't put in place a zone. But clearly, if there is evidence of local spread, we'll put in place a temporary control zone and move forward in the same way. You may also have heard rumours that there's another premises in Devon. This was detected through our post-import testing. So as you know, there's been a large number of cases in Northern Europe of Bluetongue, and some of those countries are next to or close to where there is Bluetongue circulating. You can't import or you can't export from those countries where there is Bluetongue, but if, for example, the neighbouring country is currently free, we will test any animals that are imported from those countries, and we picked one of those cases up through a post-import test. In both of those cases, we haven't put in place zones, but the affected animal has been culled and the rest of our animals will be tested. And the other, I suppose, high-level thing is that vaccination is now available. So we covered this before, but the Secretary of State has permitted the use of 3 Bluetongue 3 vaccines, provided that they are used under license. Need to talk to your private vet about this if you're interested, because these vaccines don't prevent animals becoming infected or being infectious, but depending on the vaccine and the different claims they make, they certainly will reduce clinical signs, and they may also prevent or certainly reduce mortality rates. So you need to talk to your private vet to see whether it's right for you. And if you're a private vet, obviously talk to your client. There's 2 ways that you can access those vaccines. So if you're in one of those higher risk counties, so that's East Riding of Yorkshire, Lincolnshire, Norfolk, Suffolk, Essex, Kent or East Sussex, you can take advantage of a general license. So that means you don't have to apply for a license. You just need to talk to your private vet, and if it's the right thing for you, it'll be prescribed. And then all you need to do is tell us the number of animals, the ID of those animals that you've vaccinated, and we'll keep a record of that. If you're outside of those counties, you can still apply for a license. There is a specific license in England. It's only in England. All you need to do is to fill in a form that will be downloadable, but at the moment you just request it and it'll be emailed to you. Fill in your details, upload it to the licensing portal, and provided that we're content that there's plenty of stock available, that will be authorized. So that's a new development, and the vaccine from one of the 3 suppliers is now in the veterinary wholesalers, and we are aware that at least some vets have acquired it and are ready to start vaccinating. Next slide, please. So I'm not going to go through all of the movement controls and licensing because I've covered that off before, but there may be Q&As. But just a reminder, there's 2 types of license. There's a general license, and if you are eligible to use that, all you need to do is download it from the gov.uk website and take it with you when you're taking advantage of it. So if you're moving, for example, from a zone direct to slaughter to a designated abattoir, give that the relevant general license to the haulier, or if you're hauling it, take it yourself, just as that evidence that you're aware of the rules and are complying with it. For those that a general license isn't available, you need to apply for a specific license, and you do that through the APHA online portal. You do need to allow at least 5 days for that license, sometimes slightly longer if it's a complex or a high risk movement. Next slide. I think I might have one more. So just a reminder that susceptible animals are ruminants and camelids. So all other animals, so pigs and poultry, equines, for example, can move as usual. You don't need a license for them. But the germinal products, so semen, embryos, or ova, are restricted in those areas, and there are some things you can do and some things you can't do. And also, if your premises straddles the border, you're deemed to be inside the zone. And I think that's probably it from me, and we can pick up any questions on designated abattoirs or movement licenses, etc., in the Q&A.
Great, thank you, Gordon. I'd like to welcome all the speakers back to the screen, and we'll begin the Q&A. There are a few questions that were asked, and I think you've covered them actually, Gordon, on vaccine, but just to confirm, from a vet's perspective, in order to apply for vaccine, they need to go on the portal and submit a license. Can you just repeat what you said on that again, please?
So it'll be the keeper that needs to apply for the vaccine
Right.
to use that. So if you're outside of those high risk counties, the keeper applies for a specific license to vaccinate. They will then need to have that prescribed by their private vet. Once the vaccine has been administered, the keeper or whoever is the person that's vaccinated those animals needs to tell DEFRA by sending in a pro forma the IDs of those animals that have been vaccinated. And we're also asking the private vet just to send us an email to say how many doses they prescribed. They don't need to tell us who they prescribed it to. That's the responsibility of the keeper that's taken advantage of that. But we are asking the vet to give us a heads up how many doses they've prescribed. And I think we're asking where, which county.
Great, thank you. And I think you touched on this as well, but will the vaccine be available for everyone in the UK, or might it be limited to restricted high-risk area farmers?
So at the moment, you can take advantage through a general license. So you don't have to apply for anything. You just talk to your private vet in those high-risk counties. And in the rest of England, you can apply for a specific license to vaccinate. We've done that because we just want to make sure that those at greatest risk, greatest need, have first dibs at it. We think there'll probably be 1 million doses available, very soon, but we don't know what the demand is. And we just want to manage that so that those people who are bearing the brunt of this, at least initially, have first access to that. If there's low take up or demand there's plenty of supply, then we'll extend the general license, probably incrementally out to high risk areas. But obviously, I can only speak on behalf of England. At the moment, you cannot vaccinate in Wales or Scotland or Northern Ireland, even though the permit would in theory allow that, but the administration of that is a devolved matter, and Wales, Scotland and Northern Ireland currently don't permit that.
Great, thank you. And in relation, where can a farmer download the license, the form for the license?
So at the moment, you have to send an email to say, please can I have the form. If you look at gov.uk, and we'll circulate the link afterwards, there's the email address to get that through. that'll just be emailed to you. You fill it in and then upload it through the APHA licensing portal. Very soon, it could be as soon as tomorrow. You should just be able to download that. But because it's an interactive form, we've just got to go through all the due diligence process. So it'll be available soon. But the licenses are available, and we know at least 4 people have applied for it, so we know it works.
Great, thank you. If the vaccine is supplied by the normal vet, is there a requirement for a form to be filled in?
Yes, we need to know every person that is vaccinated, and we want to know that so that at some stage in the future, if we come across that animal as part of ongoing surveillance, we'll know that that animal has been vaccinated, and so we'll be able to say, well, if it's seroconverted, so it's got antibodies, we'll know that it came from the vaccine, so it'll help in surveillance, it'll help in at some stage in the future, maybe country freedom. That's a long way down the route, but we need to know that, so that which animals have been vaccinated.
Got it, thank you. Okay, so moving away from vaccines for the time being, once we get to the low vector season, will free testing still be available in the restricted counties prior to movements, especially pregnant females? Gordon, maybe one for you or perhaps one for Sascha.
So I think we don't yet know what, we're not saying that the restricted zones will end at the start of the vector free period. So at the moment, any animals moving out of those restricted zones to live are eligible for a free test. You need a free pre-movement test and a post-movement test, and those are still funded by government. I can't promise that that will last forever, but that's the current policy.
Great, okay, thank you. Questions are slowing down slightly, so can I just remind the audience that we've got Tony Goodyear here that can answer questions on designated abattoirs. We've got Sascha here from APHA, and we've got Gordon here from DEFRA. So any questions, please send them in. There's a bit of feedback that it's quite difficult to fill in that license form and can be made easier. But Gordon, I think you alluded to the fact that we're at the beginning of this process and you're trying to make it easier. Soon it will be downloadable.
It will be downloadable, but it really all it asks for is your name and address, why you want to use the vaccine, and how many doses you want to use. It's a really, really simple form.
Okay, thank you. What is the herd status of the farm in Devon?
So I'm not quite sure I understand the question.
Obviously, we know that we've had that one case on the farm in Devon from an imported animal, and
Okay,
that animal has been culled.
So it's not a case. We believe that the animal that was imported brought it with them, so it wasn't acquired in the UK, so it is no case. The premises is under restriction to make sure that disease hasn't spread from that imported animal to other animals in the area. Once we're reassured that nothing has happened there, then that premises will be lifted from restrictions, but it doesn't count as a case.
Great, okay.
If that's what the question is.
I think so. I think they're asking if the herd that imported that animal is clear, but like you said, they're under restrictions. So for the time being,
under restriction,
that's their status.
Yeah. So the initial tests are fine, but we have to wait for a full incubation cycle in a midge, so it'll be another month or so before they're retested, before we can assure ourselves that there hasn't been any local spread. So it won't be any time soon.
Great, thank you. Next question is, what is the rate of mortality in flocks and herds where Bluetongue has been confined?
Probably confirmed, yeah. It's a really difficult one, and I think we will soon be asking for some more information from the collective community. We know what we know, which is the point at time that we went and did that clinical inspection and confirmed disease. What we haven't got a really good handle on is how many animals might have got infected subsequently, how many may have died subsequently. We will be doing some follow-up work with those known affected farms, but I think there is an intention for an industry-wide questionnaire looking at some of the impacts from this. So we would encourage anyone that's been affected to fill in that questionnaire and to help all of us better know. Now, Sascha may have a bit of an insight in terms of sort of levels of mortality, but it's quite difficult to say whether they actually died of Bluetongue or died of something else. But anyway, Sascha, I don't know if you can add anything.
Yeah, I know everyone must have heard the stories about Holland where there's very high mortality. I do think it's different here in England at present. We are seeing mortality in sheep, and that is due to Bluetongue.
You've just flicked onto mute, Sascha.
Sorry. Like Gordon said, for cattle, we think it's due to other causes, not due to Bluetongue. But in reality, we haven't had very high mortality and clinical signs, even though our sheep are definitely showing us a lot of clinical signs. Some of them actually are getting better. Equally, some of them are dying. So it's difficult to say, how many they are exactly. And we would encourage farmers to give us more details about further disease on their farms.
And if any of the vets in the audience or farmers who may unfortunately have been affected want to stick anything in the chat, we welcome any feedback from that. But we do know that some animals have been euthanized because of on welfare grounds, because of the clinical signs they're showing. So even if they don't die, sometimes they have to be euthanized on welfare grounds, and I think it's important to stress that.
Thank you. Are you able to share whether the infected animal in Devon was part of the beef herd, dairy herd, or sheep flock?
So could you repeat that again?
Yes. Are you able to share whether the infected animal in Devon was part of the beef herd, the dairy herd, or a sheep flock?
I can't comment on that. I think that's a matter between the farmer and us.
Yeah. Okay. If an animal has contracted the virus, will it test positive for the rest of its life?
So when it's a really difficult one. Definitely at some point, so we test for the virus itself, and at some point that will be negative, but we also test for antibody reaction to the virus, and it's very unknown how long they stay positive to that. So it could be years. I mean, there are still cases where we are detecting animals from 2007, 2008 period when we had BTB8. So there's antibodies to that vaccine at the time. So and possibly they had natural infection. So the science is really unknown on that side of it, but they can show antibodies a very long time. It doesn't mean they're protected though. It just means they've got the antibodies.
But that doesn't mean if they're testing positive for antibodies that they're testing positive for the virus currently. It doesn't mean that they're necessarily infected currently.
No, so if they have if they're just positive for antibodies, it could mean either they were vaccinated with Bluetongue vaccine 8 at the time, a long time ago, or that they've undergone disease either in the past, a long time ago for Bluetongue 8, or because they've currently in the past season been infected with Bluetongue 3. Because obviously we did have an incursion of Bluetongue, even though we do not think the virus was circulating at that point in time.
And we do know from some of our surveillance that you can pick up, a PCR signal. It's not saying that it's infectious virus, for at least 5 months. So you can pick up a PCR signal for that period of time. I think the WOA guidance is that 60 days after that initial signal, then those animals should be deemed to be, not infectious. But you then need to know when it was infected to count the 60 days back, if you see what I mean. But as Sascha said, you'll pick up antibodies for a long period of time. So that's why we need to know that animals are vaccinated, because we will definitely pick up the antibody from the vaccine. They're not DEFRA vaccines, so we can't tell from just testing that animal whether it was a vaccinated response or a response to actual infection, which is why we're wanting people to tell us which animals they've vaccinated. Now, clearly, there's a legal requirement to keep that information in your record books, but what we don't want to have to do is to phone back every single farmer to say, was this animal one of yours, if we pick it up in Scotland or Wales or something at some stage in the future.
Yeah, okay, thank you. In the southeast, how far is the most westerly case? Are we expecting it to extend to Hampshire with the direction of the winds recently?
The most westerly, all apart from the one I mentioned in Bath and North East, they're all within the zone, and they're all within. None of them, I think, are within 20 kilometres of that boundary. So, but that's the known ones, and obviously with relatively free movement in inverted commas within the zone. If animals are being moved about, they can be moved right up to the edge of the zone, and if they're bitten by a midge, and the cycle can continue, and those midges can fly a few kilometres. It's really difficult to model how far that they tend not to get blown so far over land, so they tend to move on their own free will over land, we think. So what we're urging people to do is only move stuff within the zone, only move animals if you need to move animals within the zone. Clearly, you've got businesses to run, and we're not trying to stop you do that, but please don't move anything that has any sort of clinical signs indicative of Bluetongue. Just be careful, really.
Thank you. Sascha, one for you, I think. How possible is it for animals with Bluetongue now to infect others in the spring during mating?
So for animals infected now, if they're not pregnant and if they're not entire males, then no, they'll have gone through the disease, and they will not infect midges. Animals do not infect each other. This is not a contagious disease. It is a disease spread by midges, biting midges. Now what is obviously a risk are pregnant females who might have a calf in the springtime. When the dam is pregnant, when it's bitten by an infected midge, the calf could get infected inside the placenta. So when it's born, it could actually be an infected animal. And if a midge then bites it, then the whole cycle starts again. So that is a possibility. And entire males are also a risk with their semen and the germplasm, so embryos and frozen semen as well. But we do have approved centres where we test all the bulls to make sure that doesn't happen. But obviously, people who have bulls on their farms, it's always a risk.
And that's one of the reasons why we have the controls on. Well, it is the reason why we have controls on germinal product. So yes, you can have an infected ram or bull, and it could be serving animals now. But what we really want to stop is you freezing semen from those animals, and storing it for a couple of years or so, and then using it, and then it all kicks off again. So if you freeze any germinal products within the zone, you need a license, or you need to have a designated facility. So you're not allowed to freeze germinal products in that restricted zone without a license.
Okay, back to the vaccine. Are there any known side effects for the unauthorised vaccine?
We'd urge you to talk to your private vet. There's the manufacturers in instructions online. These, there are. It'll tell you what things have been tested on. So, for example, there isn't much evidence on the use of male animals. I don't think there's any evidence of male animals. So you just need to talk to your private vet and talk through.
Thank you. One of the slides stated once vaccinated, an animal needs to be tagged or bolus for life. Is that correct?
You're not allowed to vaccinate them unless they have an official ID, and that would be a tag or a bolus or whatever. So a paint mark on the side, doesn't count. It needs to be a proper official unique ID.
Thank you. Will there be a minimum time period that the restricted zones will be in place? For example, 60 days from the last case?
We've not set a minimum or a maximum. We need to see how the epidemiology goes. We need to see how many cases we get. We need to see where those cases are. So we can't really advise on how long those zones are going to stay in place.
Okay. Will vaccinations make any changes to the movement restrictions?
In short, no. Because these vaccines don't have they reduce clinical signs, but they don't prevent infection. And in fact, if they mask some of those, if they do reduce clinical signs, it's even more important that we test them if they move out of the zone. So vaccinated animals need to be pre and post movement tested if they're moving out of the zone. And I think we've covered it before, but it won't facilitate live export trade either. So you can't vaccinate those animals and then export them because there is no guaranteed period of immunity.
How do you make your decisions on the zone extensions?
So we base it on the information that we've got. So the decisions over the weekend were because we had cases right on the border, and so we have a nominal 20-kilometre radius circle around each of those cases. And if that 20-kilometre circle goes into a neighbouring county, that'll trigger a discussion about extension. The other thing that we're doing is surveillance. So a number of those cases that we've confirmed have been picked up through surveillance. So if anyone is on the edge of that restricted zone and have cattle, you're almost certainly going to be approached, or one of you or your neighbours may be approached, because what we're doing is surveillance along the edge to see whether the edge is in the right place. So that could be just inside the zone or just outside the zone. And we're focusing on those higher risk areas of the edge.
Okay. And just to add, for surveillance, when we undertake surveillance, we do that in cattle. So we will sample 35 animals on a farm. So that's a blood sample, just so people are aware. And we will inspect all animals, all susceptible animals on farm as well.
I mean, I don't know who our audience today are drawn from, but people get very anxious about why we're testing and where we're testing, and always think the worst. So we will be testing in the edge, so outside of the zone, but we will also be testing on report cases. So if a farmer reports suspicion of disease, we'll obviously go and do a veterinary investigation, and we'll test those animals. So far, it's been good that those report cases have been negative, but the other ones that we will be testing is where there is a tracing from either from the zone, what is now the zone, or from what is now a confirmed infected premises, but those animals moved in the high risk window before those zones were put in place. We will trace them and we will go and test them. So if you hear rumours that someone is testing in, I don't know, Shropshire or Devon or Cornwall or anywhere else like that, that may well be an animal that was traced from that area. and what we're just looking to do is to rule out local spread. If we find a positive signal, then we'll put in place a temporary control zone, and we'll start the process again to see if there has been any local spread, and that's how that case in Bath and North East Somerset was picked up through one of those tracings, and we found a positive animal. It was culled, and we're just checking that there is no onward spread.
Thank you. Is there any evidence yet on if one vaccine is more effective than the other? You mentioned that there are three manufacturers of vaccines. I think, are there three separate vaccines or three manufacturers of the same vaccine?
No, there are three different vaccines, three different companies, and we don't have any evidence of the efficacy of that. I would urge private vets to talk to other private vets and take their own opinion. We've got no information on that. Obviously, I'm not even sure that a single animal in the UK has been vaccinated yet, so we have no information of our own. And I think we've already found that the situation, in terms of the clinical picture here, is slightly different from the Netherlands and Belgium and Germany. So who knows what the position will be.
Just to note that the Veterinary Medicine Directorate has looked at the efficacy and the safety of the vaccine, so they were happy for this to be used within the country. Just to make you aware of that. But yeah, we can't comment on any of the vaccines. That's up to the manufacturers and the vets to discuss.
And they make slightly different claims. You need to look at the equivalent of the SPC. It's not called an SPC, but the manufacturer's instruction, and
okay,
take that view.
A question from a vet then. So if a client calls in with an animal showing signs suspicious of Bluetongue, should it first be reported to APHA, or can the vet attend the farm first?
I don't know if Sascha was. So it does need to be reported in, but please go and visit and do your duty of care to that animal.
So it can be done at the same time. So please report and please go out. Just because maybe that animal is sick and it needs treating. And the welfare is of utmost importance, but reporting diseases as well.
I mean, I think, we have to remember this is a vector-borne disease. It's not foot and mouth. It's not an infectious disease. So, you can go on to another client's premises afterwards. You haven't got those restrictions in terms of, not going near other animals or whatever. Obviously, normal biosecurity obviously applies anyway, but.
Sascha again, I think. Of all the confirmed cases, did all of the animals have clinical signs?
So no, there's a mixture. So we have passive surveillance. So they're the report cases that come in, and but we've also, so they're clinical signs. But we've also been undertaking surveillance, as Gordon has already mentioned. So we've been picking up cases of those, which is cattle, in all fairness, because they often don't show signs. So we're picking up a lot of cattle via surveillance, and we're also picking up positive cases via tracings that we're undertaking. So from premises that have been infected and where animals have moved prior to the zones being in place. So yeah, a variety. But at the minute, we've got more cases that are positive that are showing clinical signs than any of the others.
So I'm not sure that we've actually published this data, but we probably should. So at the moment, I think that 58 of those cases have been from clinical signs, i.e. report cases. So as Sascha said, the majority, are from those signs, and the others have been picked up either through tracing activity, through free testing, or through the surveillance.
Is that 58 of 98?
Yes.
Yeah, okay. Just a reminder to the audience as well, images and a list of all the clinical signs, that they're available on the gov.uk website, AHDB website, Ruminant Health and Welfare website, that they're accessible and they're there for you to view. Is it true that vaccination will make pre and post testing difficult, as they will come back as a positive?
The straight answer is no, it won't make it difficult, but we have suggested that you don't test them on a pre-movement test within a week of vaccination, it's probably a good thing to do anyway. But just in case there is that sort of post-vaccination blip in a PCR signal, a false positive. This is an inactivated vaccine, so you won't get a PCR signal as such, but you sometimes just get a blip on the signal. So we say wait a week, but it won't impact anything else.
Yeah, so vaccinated animals should be PCR negative and ELISA positive, so they'll show a positive on antibodies, but they should not be showing PCR positive. So in a way, it's kind of a DEFRA, but not quite.
DEFRA for 5 months.
Do you want to just clarify what DEFRA means? It's an acronym, so I'm not sure everyone will be aware. I'm testing you now.
Because I'm great at acronyms.
I can't remember. Differentiated something. I can't remember. We'll look it up.
So in essence, it's a marker on the vaccine to be able to show that it's a vaccinated against so Bluetongue, that it's not the virus itself, but it's actually a marker to show that it's a vaccine.
Okay, thank you. Sascha, you mentioned that you're doing the surveillance in the cattle. Does that mean you're not doing surveillance in sheep?
So sheep are showing clinical signs, so that's really easy. And also furthermore, cattle tend to be a better marker for showing rare diseases. They're bigger, midges are attracted more to cattle, so they'll tend to bite cattle more than they would sheep. Sheep are quite woolly as well, so it's a better way statistically to find out if there's disease in an area or not. And they don't show signs, whereas sheep, they tell us. So that's kind of quite easy. And if you go back to last year where actually no animals showed any signs, we did find the disease was nearly all in cattle, not the positive animals were all in cattle, near enough all in cattle. There were very few in sheep.
Thank you. Just a reminder, Tony is here to answer your questions on designated abattoirs, but he is also acting as technical support in the background, and he's just provided that definition of DEFRA. So differentiating infected from vaccinated animals, that's what DEFRA stands for. When can I use another vaccine after I've used the Bluetongue vaccine?
That
will be on the data. That's the data sheet,
and to discuss with your private vet about that. Yeah.
Sorry, just to clarify, a discussion with your private vet.
But you need to remember that some animals need 2 doses, so. But yeah, clarify with your private vet.
Sorry, Gordon, I know I'm cutting you off there. There's just a bit of a lag with the audio, that's why. Can vaccines be used outside of the restricted zones? We've mentioned applications for use outside of restricted zones, but what you were saying is different than APHA advised. So can you just clarify that again? Can vaccines be used outside of restricted zones?
Yes, provided you've got a license. And the same applies if you're in a restricted zone and you're not in a high-risk county. So you either need to have a specific license or use the general license, but you're still vaccinating under license, and there are conditions in that, one of which is to tell us, but there are also other conditions associated with that vaccination. But yeah, as long as you're in England and you either apply for a license or take advantage of the general license, you can vaccinate outside of the zone.
Okay.
If anyone's got information of where that might be written down somewhere else that contradicts that, let us know and we'll change that. I mean, it may be historical information based on Bluetongue 8, because in Bluetongue 8, for example, you couldn't vaccinate in the zone. You had to vaccinate in the zone. You couldn't vaccinate outside of the zone. So I do wonder whether there's some confusion about Bluetongue 1, 2, 4, and 8 compared to Bluetongue 3.
Okay. If a farmer is outside of a restricted zone and needs to move animals into a restricted zone, not to an abattoir, is the general license correct? Is that the right license to obtain for movements?
In fact, you need to, if you're moving into a zone, you just need to be aware of the general license 612. But other than that, you don't need to apply for anything. You just need to know that you can't come out again. So just be mindful of that. So if, for example, there was a show or a market inside the zone and you move freely in, you can't move freely out. You would then have to pre and post movement test, even if you went in for a day.
Thank you. If a haulier is collecting lambs for slaughter, are there any guidelines or restrictions if they're collecting from multiple sites from both within and outside of the zone?
So we wouldn't allow, if you'd picked up from within the zone, you wouldn't be allowed to pick up from outside of the zone.
If they were to pick up from outside first and then came in and then went to a designated abattoir, would that be okay?
The trouble is you need to apply your insecticide to the vehicle before you load the animals. I think we'd probably just need to look that through, but at the moment I don't think that would work.
Okay. Sascha, are you able to tell us what the current cases are of sheep versus cattle currently? Are we seeing more cases in cattle or more cases in sheep?
Oh,
That's really difficult because we're reporting cases at a premises level, and we're not testing every animal on an infect. If you go back to what we did last year, we tested every single animal on the premises. We tested every single animal in the zone. We're not doing that now. So once we have a confirmed positive animal, we stop testing because there isn't anything to be gained from that. So we probably don't actually have that information. And it's also confused by the fact that we're only doing surveillance in cattle, so that will automatically skew the data because we're not testing the sheep on those things. So I think it would be misleading, even if we told you, it would be misleading. But I think there's been more clinical signs in sheep than cattle. That's probably what we can say.
How much of England has to be in a restricted zone before we put the whole country into a zone?
I don't think there is a black and white figure. This is about how the disease is spreading. I think we've published the framework. We'll review the situation. If suddenly we were getting lots and lots of cases, we might consider that, but we're a long way off that at the moment.
Okay. We're approaching time, so I'm going to ask you two last questions, and then I'll remind the audience of the Bluetongue hotline number that you can call with any further questions. So are there any subsidies available for the cost of testing outside of the restricted zone?
No.
No. Okay.
For a post,
if it's a post-movement
test,
then yes.
Yes.
You see what I mean?
Okay, so for post-movement testing, there is subsidised testing available. And how do you access that? Through APHA?
Yeah. So as part
through
of
farm
the
care. So yeah, it's part of the movement license. So there is pre-testing and post-movement testing, and the details are on the gov.uk website. And it's if you want to have free sampling, because the testing is free in any case, you can contact the farm care, there's a number there to contact them. And if you want the sampling done by your own vet, then you will have to pay your vet, but the testing would still be free for those post-movement and pre-movement tests.
Fantastic, thank you. For goats and alpacas, would you recommend using the sheep protocols for the vaccinations?
You have to
Again,
talk to your
this really, yeah. it's the vet who will advise on that, as well as the company, the pharmaceutical company involved.
Okay, thank you. Tony, I'll just pose that question to you again, see if you can come in on this. So if a haulier is collecting lambs to take to slaughter and they're collecting from multiple sites, both within and outside of a zone, do you know of any guidelines or restrictions?
We'll come back to you on that because it's part of the general license, and I just need to revisit that. But it's not what the intention is to allow multiple pickups and then to go into the zone and then pick up and then drive back out again. What we're looking to do is, have consignments that go direct to the slaughterhouse. But we'll come back in writing on the conditions of that general license, because the general license will apply from within the zone, outside of the zone. It doesn't apply obviously until you get into the zone. So that's why it's complicated.
Yeah.
But I don't think my instinct is, and I'd need to look at it, that you can't comply with the general license if you've got a vehicle parked full of animals.
Okay.
And you certainly can't stop when you've left the zone on the way to the abattoir.
Okay. We've still got questions coming in, but we have run out of time for today. So just to remind the audience that we are holding these webinars weekly. There are opportunities to ask your questions weekly. If you can't wait until next week, which I completely appreciate, the Bluetongue hotline number is 02477710386. And there's also resources, frequently asked questions available on the Ruminant Health and Welfare website, as well as AHDB's website, gov.uk's website. There's a whole host of information, so perhaps check those out first. And if you can't get your answer, please do get in touch. On the screen here, we've got some additional support available. So please note that there are people out there to support you and help you in this time. So perhaps take a picture of this screen. You might not need the help now, but someone else might, or you might need it later on. So please note that that is available. Thank you everyone for joining this evening. Thank you to Tony, Gordon and Sascha for presenting and taking all of your questions. And just a reminder that next week, 2nd of October, we have our next webinar on Bluetongue. Thank you.
Thank you.
Thank you.